Hi, everybody, and welcome to the very first episode of The Buzz, Pediatrics and Parenting with Dr. B, or maybe it's Parenting and Pediatrics with Dr. B. This is our first episode, and I expect to screw up quite a lot. And I can't wait to look back and see just how awful it was and say, oh my gosh, what was I thinking? But I'm a board certified pediatrician in rural Georgia. I've been doing this job for about 30 years, and I'm getting older, so it's time to hand down the knowledge to the younger generation of pediatricians and residents and students, and also to parents, of course. I've been making handouts for teaching about everything from allergies to strep throat, and I give those to my patients, parents, all the time. And so I thought, why not make a video series? Because then this will be available 24/7 for people, and maybe you'll get something out of it. I hope you do. One thing I love to do is ask kids, what do you want to be when you get older? What I always tell them is, I would like to be a teacher one day. I've had a lot of jobs. This is my current job, which I've done, like I said, for about 30 years. But as I get older, I do want to become a teacher. But the truth is, there's a lot of teaching involved in pediatrics. We teach kids how to eat healthy and when to brush their teeth, and that they should listen to their parents, of course. And we teach parents what to do at 2 a.m. when the kid is crouping or when you have a fever that won't go away. So these videos will be mostly, for parents. But like I said, also students, residents, young pediatricians, a lot younger than me, can get something from this. Hopefully they'll get the spiel down, which means how to talk to people and calm their fears. Because a lot of pediatrics, I always say it's 5% medicine, about 95% public relations, and knowing how to talk to people. I've mentored countless numbers of pre-med students, and currently I'm in an official capacity with Brenau University as a adjunct clinical preceptor and teaching the physician assistant students. And I've just been assigned to Medical College of Georgia, Department of Pediatrics. So I'll be getting medical students from them soon. One day I would like to go into academics full time, but I don't want to panic any of my current families thinking that I'm going to leave. I'll be around for quite a long time yet to come. But what we're going to discuss in this series of discussions and videos is everything from allergies to something that starts with Z, maybe Zika virus, allergies to Zika virus. There we go, A to Z. And what I hope you get is more important, not what we're discussing. Most important is what you're going to get out of these videos. I hope that you'll be able to understand when you need some outside help, because you're going to know your child a lot better than I do. You're going to know how they act when they're normal, and it's going to be up to you to determine when things are not going the right way and when you might need the advice of a pediatrician or someone else, or a nurse practitioner, whoever you work with. But hopefully we'll get some information to you that you can use when you're taking care of your own child. A lot of people do complain, if I come in, it's been 2 days of cold, am I coming in too early? There's no ear infection yet, we'll tell them. Or if they come in, the kid's been sick for 3 weeks, did I come in too late? Well, that's a very fine line, actually, in pediatrics, and we're going to talk about that kind of thing too. But I just wanted to introduce myself. This is not going to be anything medical today. We're going to do the next episode. I think we're going to do strep throat, and measles has been in the news. We've had a lot of cases of measles in Texas. And there have been cases, at least one case I know of in Georgia, is a problem that we all need to recognize as soon as we can and take care of it so that we don't have any bad outcomes. I would like to make 2 requests before we leave today. Please like, subscribe, share this video so that I can keep bringing you research-based and experience-based videos on different diseases and different problems, different childcare questions. And please do get in touch and send us your questions. Send us what you'd like us to talk about, and let's connect and get a dialogue going. Like I said, my life has been devoted to service and teaching, and this is what I do. It's fun for me. No one goes into pediatrics for the money, as they say. So anyway, reach out to us. Find us here or on Instagram or on Facebook, and let's connect. It was good talking to you. This is Dr. B on The Buzz, Parenting and Pediatrics. That's what it is with Dr. B, and that's me. Thanks for coming. We'll see you next time.